One of our main findings was around how people in detention, although they might not meet a clinical threshold for a mental health problem, they're experiencing mental distress, and to a point which was debilitating and sometimes life-threatening. I met one man who'd been identified at risk of taking his own life, who hadn't met a threshold for a clinical diagnosis, but was experiencing severe levels of mental distress. The people we met had been through multiple traumas in their life, whether that be fleeing persecution, witnessing their families get killed, having to leave their country because they were going to get killed because of their sexuality, or escaping from a domestic violence situation. And then the experience of living in detention, of reliving that trauma when you're in isolation, of not feeling listened to or believed. As one person said, as feeling captive and feeling isolated exacerbates the mental distress they're experiencing. So one of the areas which appeared to be exacerbating this distress was the level of uncertainty that people in detention were experiencing around what was going to happen to them. And the healthcare staff also discussed the powerlessness that they felt in being able to support people in detention through that uncertainty, because after all, they didn't have any control over what would happen to them either. The staff talked about the ethical dilemmas that they were presented with daily in trying to support individuals, because they didn't know what was going to happen to them. They didn't know whether they would be able to receive continued care if they did get deported, and several staff felt like they'd failed them as clinicians. We met staff who were providing fantastic care and support to people in detention. For example, emotional wellbeing groups that were held weekly. Across the centres, they're trying to implement a model of step care, and we did see examples of emotional wellbeing groups being run weekly, of short-term psychological interventions aimed to support individuals to develop coping skills, but the care on the ground is patchy, and the challenges faced by staff are enormous, with high levels of staff sickness and problems with staff retention. This further exacerbates distress and capacity for care. Additionally, staff talked about how they were swept up into a culture of disbelief. And people in detention we spoke to talked about being treated as if they were lying and not feeling like they were believed. One thing we found was that there's no clinical screening before somebody enters detention, which means that people who are very unwell often enter the system without these vulnerabilities being detected. We met several people who appeared to be experiencing psychosis and should not have been in detention. However, the main challenge is that the majority, if not everyone, in detention experiences mental distress. And the re-traumatizing impact of being in isolation, of reliving the trauma, of not being listened to and feeling captive exacerbates this distress.